them.
Okay, ma'am.
All right, good. So if you've read and understood, considering it surgical pathology station, please tell me what would be the differential diagnosis that you'll consider for this patient,
Okay, it may be a case of metastatic malignant melanoma or
right?
squamous cell carcinoma or lymphoma.
Okay. How would you confirm your provisional diagnosis or differential diagnosis? What investigations would you ask for?
Okay. I'll confirm my diagnosis by taking history, examination, and
Right.
investigation. In investigation, I will do the FNAC or biopsy from the lumps in the legs, and I'll do the X-ray or CT scan in the chest, abdomen, and
Right.
some blood test.
How would you define the term melanoma? What is
It's a
a melanoma?
malignant neoplasm arising from the melanocytes of the skin.
Epithelial melanocyte. Yes.
Yes, ma'am.
Right. And what are the most common sites from where melanoma arises?
Melanoma arises mainly from the deeper layer of the epidermis.
From the skin. And other than skin, what are the
Yes,
other
yes,
sites?
yes. Ma'am, it's maybe the mucus of the GI tract, retina, or nasal cavity.
Very good. This is what I was asking you. Right. Right. You have said that, all right. Considering that this is malignant melanoma, where exactly would you look for the primary origin of the condition?
Yes, ma'am. I will examine the patient and both the lower extremity and his nail bed and also the sole of the foot. And I'll for the metastasis, I'll check the chest and abdomen.
All right, good. Okay, after you have confirmed your diagnosis, what treatment can you suggest for the patient
Okay, ma'am.
suffering from malignant
After confirm
melanoma?
my diagnosis, I treat the patient by multidisciplinary team approach,
Yes,
and it includes the pathologist, medical oncologist, radiologist, and the surgeon himself,
yes.
and in a teamwork. For the lymph nodes, I'll do the surgical excision with adequate margin and the block dissection of the lymph nodes, and for the metastasis purpose I'll do chemotherapy or radiotherapy.
For the sake of knowledge, what are the different types of malignant melanoma that you are aware of?
Yes, ma'am. For five types: the superficial spreading, nodular, lentiginous, acral, and desmoplastic.
Right. If you could tell me what type of melanoma is epithelioid?
Yes, superficial spreading and the nodular variety are the epithelioid melanoma. And
In
its
which,
epithelial cells are the
yes,
large and rounded cell with abundant eosinophilic cytoplasm, prominent vesicular nuclei, and large nucleoli.
okay. If you could tell me, a patient suffering from malignant melanoma is also susceptible, of hypercoagulable in a hypercoagulable state. So, what are the conditions that you should watch out for, or patient is likely to have? What are the complications?
This patient may having the axillary vein thrombosis, thrombophlebitis, or deep vein thrombosis.
Yes. How would you treat a patient
Yes,
who
ma'am.
presents
For the
with
acute
deep vein
settings, for the acute
thrombosis?
treatment purpose, I will offer the parenteral anticoagulant, low molecular white heparin, followed by 6 month warfarin, and maintain the INR 2 to 3. And if the clot less than 14 days, I will offer the patient the catheter-related thrombolysis. If
Right.
the lesion is recurrent, then I'll offer the patient the vena cava filter.
Okay. When this vena cava filter is contraindicated, in which conditions?
If any renal impairment,
Okay. And
sorry, ma'am.
okay. Right. What are the risk factors which can be avoided for malignant melanoma?
Okay, ma'am. It includes the Geroderma pigmentosa, albinism, giant congenital giant pigmented nevus, and the desmoplastic nevus, Hutchinson melanotic freckles, immunocompromised patient, previous melanoma, red hair, sun exposed
Good.
area.
Okay. What are the poor prognostic factors when it comes to malignant melanoma?
Okay, ma'am. It includes the increase the thickness of the tumor, increase the depth of the invasion, site, trunk versus lower extremity,
Very good.
types of
And
the melanoma, nodular or amelanotic melanoma. Is there any ulceration?
yes.
Is there any perineural invasion, lymphatic
And
spreading, regional or distance metastasis,
yes.
male patient, older
Age,
patient,
old age. Very good. Okay. What are the
ulceration?
skin? Very good. What are the skin conditions which are associated with melanoma? Skin
Uh,
conditions.
yes,
Mm,
Geroderma
yes.
pigmentosa,
And
albinism,
yes.
giant congenital pigmented nevus, dysplasia,
Right.
Hutchinson melanotic freckle.
All right. How important is breast loss thickness when you have to excise the malignant melanoma?
Yes, it indicates the total excision of the lesion with adequate margin.
Yes. And how much should be the adequate margin?
Uh,
If lesion is
less
approximately
than
1
one,
millimeter, yes,
less than 1 millimeters, it includes the 1 centimeter margin,
yes,
and
and
more than 1 millimeter, it would be the 2 centimeter.
okay. What do you have to keep in your mind when you have to consider the Clark's level?
It's the depth of the invasion of the lesion.
Yes, anatomical level of invasion.
Yes,
Yes.
ma'am.
All right. Please tell me what are the genes which are responsible for familial malignant melanoma?
Okay, ma'am. It includes the CDK4, CDKA2, and BRCA2 and BREF.
Yes, BRCA2, MC1R, and second, the one you mentioned once again,
CDK4
CDKN,
and
CDKN2A.
CDKN2A.
Yes,
Yes, ma'am.
now good. All right. Is it uh is it any way present in which during surgery you can find out or you can find out the kind of lesion?
Yes, ma'am. By frozen section.
Yes. All right. And okay. Right. If you would have to go for re-excision of the patient, what would you, okay, what would you keep in your mind to make sure
Okay,
that
ma'am.
you are taking or you are ensuring adequate excision of margins?
Yes, I'll consider
Uh,
the size of the lesion, the bracelet thickness, Clark level, any ulceration, any
Yes.
lymph node involvement, perineural invasion.
And this time,
Ma'am.
what is another micrographic surgery thing you can tell me?
Yes, yes, Mohes microsurgery maybe.
Can you please describe the image you're looking at, please?
Yes, ma'am. There is a pigmented lesion raised from the skin surface, irregular margin, crusted, no
Rested, yes.
hemorrhage, no ulceration, blackish color.
Yes, right. Thank you. Good.
Thank you, ma'am.